Good evening, ladies and gentlemen. We begin tonight's broadcast with a significant and noteworthy development concerning global health initiatives and evolving U.S. policy positions. Recent reports have circulated widely regarding the Trump administration's approach to World AIDS Day observances, prompting us to take a much closer look at the verified facts and historical context. World AIDS Day, observed annually on December 1st, holds immense global significance as a unified call to action against the HIV/AIDS crisis. It was formally established on August 18, 1988, by the World Health Organization and UNAIDS, following a proposal by CDC Task Force leader James W. Curran, with the first observance taking place later that same year in over 100 countries. The day's core purpose is to heighten public awareness of the ongoing HIV/AIDS pandemic, honor the millions of lives tragically lost, prevent new transmissions through education, and work tirelessly to eliminate associated stigma worldwide. Since 1981, when the CDC first reported those initial 5 cases in the United States on June 5th, over 40.4 million people worldwide have sadly died from AIDS-related illnesses. Past U.S. presidential observances have demonstrated strong engagement, such as President Clinton lighting the White House in red in 1999 to symbolize solidarity, and President George W. Bush launching the groundbreaking PEPFAR initiative in 2003. The U.S. President's Emergency Plan for AIDS Relief, widely known as PEPFAR, has served as a cornerstone and lifeline in the global response to the HIV/AIDS epidemic since its inception. Despite some initial reports that suggested a potential shift away from tradition, the Trump administration, in fact, continued to officially and publicly mark World AIDS Day with dedication. President Trump personally issued annual proclamations recognizing the day every single year of his presidency, specifically from 2017 through 2020, maintaining continuity. These official proclamations consistently emphasize the remarkable progress in the HIV/AIDS response efforts, including the vital and ongoing work supported by PEPFAR programs around the world. Remarkably, in fiscal year 2020 alone, PEPFAR provided a substantial $4.3 billion in targeted funding to combat the epidemic. This generous funding directly supported 18 million people receiving life-saving antiretroviral therapy and successfully prevented 2.5 million infant infections through proven interventions. Since its launch in 2003 with an initial $15 billion commitment, PEPFAR is credibly estimated to have saved between 20 to 25 million lives globally through comprehensive care and prevention. A particularly significant initiative launched in February 2019 was the ambitious Ending the HIV Epidemic, a plan for America aimed at transforming domestic responses. This comprehensive plan set an audacious goal to achieve a 90% reduction in new HIV infections across the United States by the year 2025. It strategically focused on 50 key U.S. counties, San Juan and Puerto Rico, and Washington, D.C., where approximately 70% of new cases are concentrated, backed by an initial funding allocation of $290 million. While those initial reports, though ultimately unverified, did spark important discussions, they raised valid questions about the potential implications of any perceived policy shift in health priorities. A hypothetical withdrawal from officially marking World AIDS Day could significantly diminish public awareness efforts and reduce overall community engagement on this critical issue. Such a step could also jeopardize funding streams for essential programs, affecting both domestic initiatives and vital international partnerships in the fight against HIV. For example, PEPFAR itself faced proposed budget cuts in 2020 amid competing priorities, though these controversial proposals were ultimately not enacted by Congress. Any such move could further strain international relations, especially considering the United States funds fully 55% of the global HIV response efforts through multilateral channels. Reactions from prominent activist groups like AIDS United and AMFAR would undoubtedly be strong and vocal, likely describing such a decision as truly devastating to progress. Globally, as of 2022, 39.9 million people were living with HIV, confronting the reality of 1.3 million new infections that year alone, according to UNAIDS data. Tragically, 630,000 deaths occurred in 2022 from AIDS-related causes, a slight decline, but still indicating that global efforts remain off track for the ambitious 2030 goal to effectively end AIDS as a public health threat. Current progress shows only 86% of people know their HIV status, 76% are accessing treatment, and 71% achieve viral suppression, all falling short of the critical UNAIDS 95-95-95 targets. Here in the U.S., Black Americans unfortunately account for 40% of new HIV cases, despite comprising just 12% of the total population, highlighting stark disparities. Additionally, youth aged 13 to 24 represent 21% of new diagnoses, underscoring the urgent need for targeted education, prevention, and access to services. The global fight against HIV and AIDS presses on relentlessly, with 39 million people still affected and the heartbreaking reality of 13 million children orphaned each day by the disease. This ongoing crisis serves as a stark reminder that sustained awareness campaigns, robust funding, and unwavering international effort remain absolutely crucial to victory. For more detailed information, reliable resources, and support, please visit hiv.gov, unaids.org, or call the hotline at 1-800-CDC-INFO today.